Good morning, everybody. For those of y'all, especially my clients that are in the room, you know that I can kind of carry on. So they gave me a script, which is probably a good idea to make sure the conference goes as it should on schedule. But we are so happy to have every one of you all here for the 4th annual Free Market Medical Association annual conference. Jonathan makes so many great points, but I just wanted to also for you all to kind of recognize if you all are in attendance here, you all really are free market warriors, every single one of you. And what we are doing is not easy. We are definitely taking the narrow path. So you all should be congratulated for that and for your attendance. So I'll kind of go through my prepared remarks, but attendance at this conference is evidence of the viability and the desire to have free market DIY healthcare reform. Instead of waiting or relying on government to improve the quality and lower the cost of healthcare, we choose instead to rely on the power of the individual and of the free market. When Dr. Keith Smith and I formed the FMMA, we had a simple vision. That vision was to educate and empower buyers and sellers of healthcare goods and services. Buyers and sellers need to be able to do business together in a fashion that is mutually beneficial with the least amount of intervention and distortion provided by third parties as possible. We surmised that by fostering the concept of buyers and sellers being mutually accountable to one another, that and being the subject of the judgment of the marketplace, that this could simplify, improve, and lower the cost of healthcare. And we were right. So far in 2017, we've had an incredible year of progress here at the FMMA, and not just with the association, but also with you all, the membership. I've never been involved in a conference where the networking is so prevalent and active. For those of you all that were here last night, you all witnessed it. It's unbelievable. So I would also encourage you all to continue to share your good news stories and your challenges with one another on the breaks during the conference tonight, or during the conference today, and then also before and during dinner tonight. And I'm just telling you, prepare to be inspired by one another. And now I'm going to share some of the achievements of your association this last year. So we knew that what worked in Oklahoma City in regards to the free market may not work exactly the same way in every location around the country. So we introduced the concept of FMMA local chapters. These chapters are led by members who are either buyers or sellers. These local chapters are a resource for local free market innovation based on the needs of the individual's community. Our chapters maintain and adhere to the guiding pillars of the FMMA. As of now, the FMMA has 18 local chapters around the country. These are FMMA's boots on the ground innovators that are supported by the National Association. There's a local chapter workshop immediately following this conference on tomorrow afternoon, or actually tomorrow around noon. For those that are interested in leading a chapter or would just like to get some tips or some guidance on how they can make their local chapter better. So I encourage you all to attend that as well if you have interest. The FMMA also has 290 members now located in 41 different states around the U.S. Some of these members, as opposed to being just individuals, they actually represent employers, medical practices, and surgery centers. So the effective reach of the FMMA is actually much larger than just the 290 individual members. The FMMA's growing influence is demonstrated by the demand for speaking engagements around the country. Some are small grassroots style events. Some are large gatherings of thought leaders in industry, healthcare, and government. The FMMA staff and its members are frequently asked to do radio shows, TV pieces, and podcast interviews. Dr. Smith has been invited to testify on Capitol Hill numerous times. Of course, none of us are full-time employees of the FMMA, and we all have day jobs. So sometimes balancing the demands of the FMMA and real work can be challenging, but we're up to the task, right? During the healthcare debate this summer, the FMMA was frequently asked its opinion on reform ideas. Of course, our answer was always less government, less regulation, and more freedom. Those are not always popular ideas for Washington, D.C., but they will continue to hear them from us. The FMMA also has several new member benefits and partnerships that I'd like to give shout outs to. The first is the Shop Health search tool. This is our free market healthcare shopping tool located on FMMA.org. FMMA members can have their own virtual storefronts in which they can post their cash prices and descriptions of their services. This is open and searchable for free to the general public. We've also partnered, we're very excited about this, we've also partnered with Fidelis Publishing Group out of Austin, Texas, to produce a free market magazine called Free Market Healthcare Solutions. This magazine is geared towards employers of self-funded, that sponsor self-funded benefit plans. The magazine is free to all employers and will be available in hard copy and electronic versions. Content advertising will be provided only by FMMA members and by the FMMA. So they're going to be needing some content. So we need to go by and visit them at their booth and we get a preview copy of the first edition and learn more about how to contribute or sign up for a subscription. They are just right out that door right there. We're also really excited to introduce a brand new offering called freemarketmedicinejobs.com. This is a site that is produced and managed by FMMA member Jack Brown. Jack Brown, for those of y'all that have been here for a few years, Jack Brown is a speaker here on a fairly regular basis at the FMMA conferences. And this website seeks to be a resource for putting free market-oriented medical talent to work. That is a good problem to have, that as we're starting to see more and more free market practices, they're looking for other like-minded physicians to provide assistance in their practices. FMMA surgeons and physicians can post jobs and search resumes for free on this site, while non-members of the FMMA, they will be subject to the market price for Jack services. Here's an example of a posting off of freemarketmedicinejobs.com. These are real jobs available with Dr. Kathleen Brown and Jack Brown. So if you're interested in working in the great state of Oregon for some awesome free market warriors, talk to Jack. There will also be a link to the job site off of the front page of FMMA.org. So I encourage everybody to check that out. And lastly, we want to introduce or announce another brand new partnership with David Chase and Health Rosetta. As members of the FMMA, each one of you all will receive a free electronic copy of Dave Chase's new book, The CEO's Guide to Restoring the American Dream. And in the future, the FMMA and Health Rosetta will be working together on mutually complementary projects. So please go see Sean at the Health Rosetta booth to learn more about the amazing work that they're doing. Jonathan mentioned the theme for this year's conference. It may end up just being the theme for all conferences in the future. We like it so much, but you all may ask, well, why did we choose Be a Beacon as the theme? And the answer is that FMMA is an organization that is founded on certain guiding principles. These principles are derived from things that Dr. Smith and I observed in the healthcare status quo that distorts the relationship between the buyer and the seller. These principles or pillars are a broad outline of the things that FMMA stands for. If these principles are followed, entities that benefit when healthcare is expensive, opaque, and low performing will have no legitimate role in the healthcare marketplace in the future, and they will be seen for who they are. This organization and its members are not waiting for somebody to pass legislation in order to improve healthcare in America. We are taking steps that we know will improve things, and by collaboration and mutual accountability, we are performing do-it-yourself healthcare reform now. We're shining a guiding light on the status quo, and others are following. So please, I encourage each one of you all to keep doing what you're doing. A few housekeeping items before we kind of kick this thing full open. Please keep an eye out for the amazing FMMA staff members and volunteers. They're wearing pink polo shirts or wearing FMMA volunteer badges, and they can assist you all with any questions that you all might have in regards to conference. Also, please come by the FMMA education booth and see Mindy. She is right at the kind of the dog leg of the hallway over here. And some of the things that you can do at the education booth is you can check out, see what's actually happening at the FMMA, but you can also get a fresh demo of the Shop Health search tool. You can also sign up for membership, which we think that's a really great idea, or you can renew your membership there at that booth. Also, as Jonathan said, check out the FMMA swag booth for the latest FMMA merchandise, because you've got to represent out there. We do have a conference app. I think most of you all probably have already found it, but it is located on the iTunes App Store, and also it's available for Android on the Android store. The search is just FMMA, and that will direct you to the application. Electronic versions of all conference materials are available on the app, including the conference agenda, and any slide presentations that the speakers have, they are linked under each speaker's biography. Lastly, two things. I want to also recognize and acknowledge all of our amazing sponsors for this event. Like I've told the sponsor before, this is not and never will be a sponsor-driven organization. It is a member-driven organization, and as long as it's providing value to our members and furthering the cause, this organization will continue. When it ceases to do that, this organization will dissolve, which is different from most trade associations, right? But truly, this conference would not be the first-class organization, and this conference would not be at the top level like it is right now if it was not for all of our wonderful sponsors. And also on those sponsors, I might also want to add that each one of them has been evaluated and vetted by the FMMA to ensure dedication to the values and principles of the free market. So these were not just whoever happened to wave some money in our face. We evaluate a lot of vendors, and we tell a lot of them no. If they are in the business of perpetuating the status quo, then we're not interested in having them here. So the folks that are out here that have sponsored FMMA this year and every year, they are the good guys. So be sure and go out and talk to them and see what they're all about. And then probably last thing is I'm going to introduce these. For those of you that were here last year, remember our cube, our throw mic boxes? Yeah, well, they're back. They're back. For those of you all that were not here last year, these are the mics that we use out in the crowd, and it was such a huge hit. It just personifies kind of what the FMMA is about. So if you do have a question or a comment for any speaker when they open it up to questions, if you would just kind of raise your hand, and Jonathan, but when you raise your hand, be prepared to catch, because Jonathan is going to toss you right across the room one of these mics. Now they are made out of Nerf material, so they're not going to hurt you too badly, but it would be kind of silly if they hit you upside the head. So be sure and have your hands out and ready to catch that. So with all of that, I'm going to turn this thing back over to Jonathan, and he will introduce our next speaker. Thank you all very much.